Local and live. Covering Franklin and Washington counties, it's Let's Talk TriState.
Welcome to Let's Talk TriState. My name is Tiny, and we are joined today on our Ask the Expert segment from Meritus Health, Dr. Brian McKinnon. He is Chief of the Surgery Department for Meritus Health. Doctor, how are you today?
I'm doing very well, thank you.
It's good to have you here. Now, Dr. McKinnon, before we break into some questions that I have for you about your new appointment to your new position and your current practice, if you would, take us through a bit of your history and what led up to where you are right now.
Well, I started my healthcare career as an operating room orderly in Milton Hospital, where I grew up, scrubbing the floors of the ORs. And that obviously got me exposed to healthcare in a very close to the deck plate point of view. And after college, I went to medical school up in the Boston area. The Navy paid for medical school, so after my surgical internship in DC, I went to the fleet as a Navy flight surgeon and also running dive chambers when I was at that point in operational medicine. Once I finished up my tour as a flight surgeon during the Bosnian conflict, I then did a residency in otolaryngology at Portsmouth Navy and then a fellowship in ear surgery or neurotology at University of Virginia. I finished up my career on active duty as the neurotologist for the White House, and as well as for the Pentagon, Walter Reed, and Bethesda. And then I've had a mix of academic and private practice careers, most recently at University of Texas Medical Branch, where I finished up my roles as the Medical Director of System Optimization and Performance before joining Meritus.
Wow, that is quite the resume, Doctor. First of all, in case I forget to say it, thank you for your service. We appreciate that very much.
Well, I should also let me thank my fellow veterans for their service to their country, and also those who, like me, continue to serve their communities.
Absolutely. And you are doing that right now in a big way with Meritus. First of all, congratulations on joining Meritus as the chair of the surgery department. Now, what drew you to this role and what excites you most about leading the surgical department here in our community?
So I joined Meritus because it was and is an innovative and transformative organization. It's building the first new medical school in Maryland in over a century. And it has a community that I can significantly contributing to improving its health, particularly hearing health.
Now, I also see that and understand that you are seeing patients through the new Meritus Advanced ENT practice. That's the practice that you have. Now, how does that tie into some broader goals that you have?
So I am a subspecialist within ear, nose, and throat. I'm an ear surgeon. And in addition to providing, services that many of the folks in this area would have to drive substantial distances to receive, we can do it right here at Meritus. There are very few board-certified neurotologists in the country, only a few hundred of us. And as we move forward, we're going to be beginning to offer some unique procedures such as cochlear implants, which are really only available at the major surgical centers in Maryland, D.C., Pennsylvania, and elsewhere.
Now, Meritus was recently, I feel like every time we have a doctor or an expert on from Meritus Health, there's always accolades and always good news surrounding all things Meritus Health. They're recently ranked among the 10% of hospitals nationwide and second in Maryland for surgical care by a company called Health Grades. Now, what does that recognition mean in a general sense, but more specifically then for your team and for Meritus?
So what it means is that hospitals that achieve this rating have a 32% lower complication rate related to their care. This is a group that uses Medicare data. So it looks at over 4,500 health systems across the country. You don't get to opt out of it if you don't want to do it. Okay. And then they apply through their use of risk stratification, looking at the predicted outcome versus the actual outcome. And for for the hospital system our size, we've done extraordinarily well. I mean, we're number 2 to Hopkins, which is a worldwide quality performer. So that speaks a great deal towards our staff and our physicians and everybody who supports the care of our patients.
What I like about this health grades grading system that they have, doctor, is that it is specific in what it's grading, as in it's based on the outcomes of procedures. So as you said at the beginning when you were discussing it, is this is less complications. So 30, I think she said, what, 36% less complications?
32% fewer
Okay.
complications if you achieve this recognition.
Which is absolutely incredible. Now, with a 5-star rating in multiple services, including their spinal fusion, let me make sure I get a lot of these, hip fracture, diabetic hospitalizations. What does that say about the depth of talent and innovation within the surgical team? We're sitting on the ancillary and in the periphery of this, and sure, we all know what grades A, B, C, D, E, and F are. We went to school, we had those. But what does this mean for the surgeons and the peace of mind that it provides our community?
So I would, as somebody who started healthcare in the OR scrubbing floors, quality starts at the deck plate. Quality doesn't just occur at the upper echelons, it goes all the way through. What Meritus has achieved is a recognition that mission of quality goes all the way down from the top to the bottom to the top. Part of that is esprit de corps, part of that is keeping ourselves accountable. Part of that is a constant pursuit of doing better. In addition to the health grades, we are now in our 6th year as a grade A hospital from Leapfrog Group. We're one of only a very small number of hospitals in Maryland. I think only one of 3 that have been able to get 3 A's in a row since 2023. It is really an outstanding achievement to do it 6 years in a row now. And I'm just coming in late to this, so I can't take any credit for it, but I'm hoping to continue to build on it.
And I'm sure you will. And I always say it's so wonderful these are the statistics, these are the institutions that you hope you never have to use them. But if you do, knowing that they are right here in our backyard, basically at a phone call away, is world-class service, high marks across the board. Now, Doctor, by the way, we're talking with Dr. Brian McKinnon. He is the newly appointed chair of the surgery department for Meritus Health. Your background, as you went through a little bit with us here, includes clinical leadership, medical ed research. Now, how do those areas work together here at Meritus, especially with the new surgical residency program that we're very excited about, and the School of Osteopathic Medicine?
So I'll approach it this way. I came out of a traditional siloed system where you had education here, we had research here, and we had clinical activities there, and they didn't mix. And
Okay.
over my time in
They just don't. They just don't necessarily touch.
well, they don't touch as they should. And very simply, I got an MBA early on in my career, and that's resource management. That's so you can better use resources. And then I went on to pursue a master's in public health with a concentration in biostatistics. And I'm now pursuing a master's in biomedical informatics. What those have repeatedly reinforced is that there is an opportunity for these 3 missions to have incredible synergies if you got them out of their silos. And so as an educator, I'm a leading clinician. As a researcher, I'm a leading educator. All those factors help build on each other versus keeping them separated. Mm-hmm. What we have is unique is we don't have a legacy of Meritus of these missions being separated. We can build them so these missions are fluid with one another. It's often easier to start from scratch than it is to try to change practices and approaches that have been ingrained in the culture of an organization. So we're lucky in that regard.
Absolutely. Now, for patients that are curious about, let's go back to what your subspecialty is, curious about the Meritus Advanced ENT or broader surgical services that Meritus offers, what would you say to them?
So the really good news is that for ENT at Meritus, you have 2 very seasoned, very senior specialists here. Dr. Barty, who is the chief of ENT, has been doing complex airway and chronic sinus surgeries for many, many years. He comes from Hopkins. Mm-hmm. He is very gifted as a surgeon and clinician. With me, you have a clinician who's had a varied career, first starting serving his country as a flight surgeon, who went on from there to achieve a very unique role as an ear surgeon. Requires extensive training. In addition to that, I've become a very good educator and very good at answering questions about why do things go this way and how can we do better. Those are unique talents within any health system, and yet they're here, right at their doorstep. They have to go just down to Robinwood to get this level of care.
I want to end our discussion today, Doctor, talking about you and your new role as Chief of Surgery for Meritus Health. Now, many of us who are watching and listening to this have probably watched many different television shows, and there typically is mention of a chief of surgery or a chief resident and chief this and that. But take us through the reality of your new position. What, as far as Meritus goes, is the chief of surgery? What are your duties when in that role?
So, as chair of surgery, my role is to model the behavior. I have to be the one that puts in the extra hours, who takes the extra time, who takes the time to have a better understanding of the challenges and opportunities that we have, and to constantly reframe those challenges as opportunities for improvement. The goal is to build a rapport with our patients and our colleagues. And so the level of collaboration continues to increase. And to make it clear that we should be very careful in terms of building silos because of the lost opportunity that may result in. And so my goal as the chair of surgery is to lead from the front. I'm seeing patients today. I'm a surgeon. And my goal is to not simply provide the clinical skills that I've developed over time, but also provide those all those skills, administrative, clinical, research, education, to where I am.
Very good. We've been speaking with Dr. Brian McKinnon. He is the newly appointed chair of the surgery department for Meritus Health. And Doctor, we know that you're busy. We want to honor your time here. But before I let you go, I want to make sure, and I give all of our guests this opportunity, is there anything even smaller that we didn't touch on today that you wanted to make sure our community knew?
Our community really needs to know that we're here. You can get truly nationally recognized care right here.
Yes.
We don't have to go outside of the area to do it. And we want to give it. Our goal as Meritus is to help our community. And it goes beyond just simply the healthcare. We do a lot towards wanting to improve the overall health of the community, such as the £1 million weight loss program, such as the pursuit of quality through various and sundry projects, including the Ballinger Award, which is an award given to institutions that pursue and succeed in meeting quality metrics. And that's something that I really would want the community to understand and recognize the value in.
Absolutely. I think you're going to do a great job with that. I have no doubt the surgery department at Meritus Health is in good hands with you. Dr. Brian McKinnon, thank you so much for joining us on Let's Talk TriState. We appreciate it.
Thank you very, very much.
And as we always say, we also thank you for joining us on Let's Talk TriState.
If you'd like to be featured on an upcoming episode of Let's Talk TriState, call 717-597-9200 or email letstalk@921thegoat.com.